In this unit, we're going to start exploring the psychology of obesity with a particular focus on eating disorders and obesity. Before we do that, I just want to encourage you to have a really open mind and to have a lot of compassion for others and for yourself as well. I personally am someone that has struggled with binge eating disorder, and that's what encouraged a lot of my own struggles with weight for a long time. And I know how this information can bring up a lot of stuff for you. So just be kind with yourself, be cautious with yourself, and just be aware that it might provoke some feelings in you or not. Okay, but the lens I'm using to approach this is a curious lens. It is one to help us understand this, not to make anyone feel bad in any way. Okay, so I just wanted to say that before we started. Okay, so when it comes to obesity and mental health, I have a chicken and an egg here because they really can feed into each other. So individuals with people that are dealing with obesity, that can compromise their mental well-being, especially if they have perceptions around what their body should, I don't like the word should, but let's say what they believe their body should look like, and it not looking a certain way, that can help promote certain emotional changes or some negative mental health effects. And also, certain mental health conditions can also predispose to obesity as well. Okay, so for instance, we're going to see that major depressive disorder can predispose to obesity, post-traumatic stress disorder as well. So it's hard to kind of tease out where things start. So we'll start our conversation by talking about obesity and major depressive disorder. There are many criteria that are used to diagnose someone with depression, and that is something that we would often ask for someone to use a health professional, a mental health professional, to help them figure out what's going on for themselves. That said, two of the diagnostic criteria for depression are a change in eating patterns and sleep disturbance, but this is the one that I want to highlight here. Okay, so some individuals with depression might eat a lot more, might have a higher chance of binge eating as well, or overeating, and we'll clarify the difference between those two in a bit. And some individuals, when they're dealing with a depressive episode or chronic depression, their appetite might actually be lower, but there's some sort of change in eating patterns, okay? And sleep disturbances that are more common in individuals with depression can, again, predispose to obesity through the fact that individuals might be sleeping less, and that is associated with higher levels of ghrelin, which we know is the hunger hormone, the eat hormone, okay? Depression can also predispose to obesity through the hypothalamic pituitary adrenal axis, specifically predisposing to higher levels of cortisol, which promotes visceral adiposity. Okay, levels of adiponectin seem to be lower in major depression, and remember that adiponectin is one of those adipokines that has a protective effect. And this one sucks, is that individuals with depression sometimes go on certain medications that can actually predispose to obesity. Okay, which might, for instance, increase appetite or might increase fat deposition, which can have other implications for mental health. So all things to consider when it comes to MDD and obesity. Okay, another mental health condition that is associated with obesity is post-traumatic stress disorder. Okay, so for instance, in the Nurses' Health study between 1989 and 2009, they found that normal weight women who developed PTSD during the study period also showed a significant increase in risk of developing overweight or obesity compared to women that didn't develop PTSD during that time. Okay, so what is the exact mechanism? That is still being explored. It might have to do with eating in response to emotional things, mental health things that are going on due to, in this case, PTSD, but potentially due to depression as well. Okay, but I just wanted to kind of set the framework of the correlation between certain mental health issues and obesity. Okay, plus the biggest thing we're going to cover in this unit is the linkage between obesity and certain types of eating disorders. Okay, in particular bulimia nervosa, but most of our focus today is going to be on binge eating disorder. One of the things that we find in both bulimia and binge eating disorder, and I'll clarify the difference in a second, is something called loss of control eating. Okay, LOC, loss of control. Okay, we see that both in bulimia and both in binge eating disorder, and that we believe is one of the main things that predisposes to more weight gain in both of these individuals. Okay, it's important to clarify that obesity itself is not an eating disorder, although certain eating disorders can increase the risk of obesity. So what are eating disorders? Eating disorders are psychological in nature. So you may know that I teach first year health class, contemporary health issues, and in most textbooks, health textbooks, eating disorders are found under the weight chapter, and I don't believe they belong there. I've actually shifted them into the mental health chapter because they're more about mental health than about weight, although weight is kind of linked in with this as well. Okay, they are found, the three main eating disorders that we have diagnostic criteria for, and there's a large body of literature for, are anorexia nervosa, binge eating disorder, and bulimia nervosa. Okay. That said, like I mentioned, we're going to focus on bulimia and binge eating disorder, and we're also going to mention something called night eating syndrome, which is not like it's considered its own eating disorder according to the Diagnostic and Statistical Manual of the American Psychiatric Association. It's kind of in this other category called other specified feeding or eating disorders. Okay, but it's important to talk about this too because there's more and more research coming out about it, and the DSM-6 might recognize this as its own condition, its own eating disorder. So just to give a little bit perspective of why we talk about binge eating disorder and night eating disorder, when I look at individuals that don't have binge eating, which we find in both bulimia and in binge eating disorder, and again, I'll clarify what I mean by binge eating in a bit, okay? Compared to people that don't have binge eating, individuals that do have binge eating or do experience binge eating tend to have a higher BMI, highest life BMI, both for females and for males. And the association seems, or the magnitude of the increase in higher lifetime BMI seems to be higher in males. We see something similar for night eating. Comparing people with night eating syndrome to people who do not have night eating syndrome, we see again higher, highest lifetime BMIs, both in females and in males. Okay, showing again, and these are all significant, showing again the tendency for these eating disorders to promote a higher risk of obesity. So to break these up in the next module, I'm going to start looking at binge eating and night eating syndrome a little bit more specifically. We'll talk about their diagnostic criteria, and we're going to really look at this concept of loss of control eating and how it relates to both.